Okay, hello friends. Again, welcome to the microbiology classroom. Today we will be taking the topic of mycoplasma. Okay, taking the topic of mycoplasma. So mycoplasma is basically, let us write first. So mycoplasma. If I talk about mycoplasma, the basic thing we learned in the general microbiology was these are, you have to listen and write calmly, cool. No, if you remain cool and calm, then easily things will happen, isn't it? So we don't have to stress something. We just take it lightly. Mycoplasma. What we have to say with ourselves? Taking breath and then sing mycoplasma. What? Mycoplasma. Once we take breath, what we are doing? We are oxygenating the brain. Mycoplasma. Easy way. Mycoplasma. So this mycoplasma is basically like you are doing what? No, everything, whatever I do in the class has a meaning. Okay. So I'm doing, what does it mean? It means mycoplasma is a cool guy. He 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 is a free living organism. Free guy. Small free guy. Small. So he does not have cell wall, but he is stable. He does not have cell wall. Okay. And he has cholesterol. And he is free living. He is a free living. So you should remember it's a free living organism. One thing. Second thing is he is devoid of cell wall, or you also call it stable L form, isn't it? Stable L form. Guys, am I audible? So it is also called as PPLO. PPLO means pleuro pneumonia like organism. Pleuro pneumonia like organism. Pleuro pneumonia like organism. Okay, easy. Second thing to remember about PPLO, so this is the other name of this mycoplasma. Remember, it is not having cell wall but cell membrane present. That cell membrane is made up of cholesterol. That is made up of sterols called cholesterol. Fine. So he has no peptidoglycan layer. That means he has cholesterol. He has sterols. Now you tell me, will the beta lactams work on mycoplasma? No, because beta lactams, penicillins, they break the cell wall bonds. So what, he's not having the cell membrane. Will you give penicillin to a patient of mycoplasma infection? And see, logics. Everything works on logic. There are some legend people who give drugs for mycoplasma infection, penicillin. I don't know where will they be attacking. I don't know which place will they be firing. If you want to give penicillin, you are firing at the cell wall. You are breaking those peptide linkages, cross linkages. But you are not having a cell wall. Where are you firing? No, where are you firing? You don't know yourself. Where are you firing? Okay. So this is, you have to remember PPLO, and they will be resistant to beta lactams. Resistant to cell wall antibiotics. Fine. Now this organism is showing us a specific motility. Okay. So first you tell me, will it, is it gram staining or non-gram staining? Is it gram staining or non-gram staining? It is a non-gram staining. Okay, I hope you can say, isn't it? It's a, I hope you understand why are you speaking non-gram staining, isn't it? isn't it? Yeah. So yeah, in that sense, you can understand. Okay. Um, Basically, it is having fimbriae. It is having fimbriae, which gives it a gliding motility. Gliding motility. Okay, which gives it gliding motility. Okay. Now it is also known as Eaton agent. Eaton's agent, because you can filter it. Okay, and you have an agar also on its name, that is Eaton agar. Eaton agar. Okay. Now it's you have to remember this PPLO organism. We are calling this for Mycobacterium pneumonia. Mycobacterium, Mycoplasma pneumonia. Mycoplasma pneumonia, MP. Okay, so we are calling for that. Fine. Now it has other two species. It has other two species, that is Mycoplasma hominis and Mycoplasma genitalium. Mycoplasma genitalium. These two together, what they cause? They cause genital tract infection. They cause genital tract infection. Okay. So what will be the culture media you will be using? The culture media you will be using will be Eaton agar and PPLO agar. So these agars, what they will give you? They will give you fried egg colonies. Fried egg colonies. Fried egg colonies. Okay. Fried egg colonies. Is it clear? So fried egg colonies is seen in PPLO organisms. Okay. What it does is it causes pneumonia, but which pneumonia? It causes atypical pneumonia. So now diseases, okay, what it causes? So it causes atypical pneumonia. Atypical pneumonia is called, this type of pneumonia is called walking pneumonia. Why it's called walking pneumonia? I will be telling you. See, what happens is this MP, this MP, what it does is it attaches to the upper respiratory tract and bronchial epithelial cells. Okay, it attaches to your upper respiratory tract and bronchial bronchial epithelial cells. Bronchial epithelial cells. It has a protein by which it attaches. That protein is called P1 protein. P1 protein. P1 protein. It attaches by P1 protein. And what it does is it produces hydrogen peroxide. Okay, it produces a local response, that is a hydrogen peroxide reaction. What hydrogen peroxide will do? It will start damaging. It will start damaging, isn't it? It will damage the membrane, and it will induce a response that is called, your body will react to this. It is monocytic response will happen. Monocytic response will happen to this once you are damaging something. Okay, so your respiratory epithelium, it will bring what? Macrophages, monocytes, primarily monocytic response. So what will happen? A patient will start having that long lasting hacking cough. Hacking cough. So long lasting hacking cough. Long lasting hacking cough. Long lasting hacking. cough. Okay, fine. So what happens first is patient will first have pharyngitis. I will tell you what will happen. Patient will first have pharyngitis. Then after that, that pharyngitis will spread to other areas called as otitis. Otitis is air infections. Then tracheobronchitis. Then where will it spread? Then it will go to, and then it will give me a primary atypical pneumonia. Then it will give me a primary atypical pneumonia. That primary atypical pneumonia has features. That primary atypical pneumonia has features. What are the features of primary atypical pneumonia? You will have an insidious onset, gradual onset. You will have a gradual onset of what? You will have gradual onset of fever. Okay. So what are the symptoms of atypical pneumonia? Clinical features. Number one is you will be having a insidious onset. Okay, insidious or gradual onset. Gradual onset of what? Fever. Then also it will be showing throbbing headache. Throbbing headache. Malaise. Malaise. Okay. Then what else? What else do you think? What else are the features of pneumonia? No, it's a atypical. Okay. Yes. So there will be severe cough. Severe cough. Severe cough. And it won't be you have two types of cough. I think we have productive cough and non-productive cough. Productive cough, non-productive cough. Productive cough means where you are able to produce sputum. You are able to produce a sputum. Okay. So non-productive means dry. You can call non-productive a dry cough. Okay. So I hope you should know these things. Okay. Where is the pen? Yeah. Okay. So you are producing severe cough. What else can so it will be initially non-productive. Initially it will be non-productive cough. Okay. And then by time progresses, you will have within some weeks, many weeks, you will be showing the chest x-ray. That radiographic techniques, they will show us what? Radiographic tools, they will show us uh, infiltrative pattern. So on radiograph, on chest x-ray, I will be seeing an interstitial or bronchopneumonic pneumonia. Bronchopneumonic pneumonia. Bronchopneumonic pneumonia. Okay. Clear, guys? I have to ask again and again, is it clear? Is it clear? Because then you have doubts. Okay. So this is all you can have. Okay. So by the way, what else it has? By the way, this if it was having a P1 protein, what else it has? It has also glycoprotein, glycolipid antigen. Okay, remember that. So the virulence factors, what virulence factors it can have? Virulence factors, it is having P1 protein in the cell membrane and glycolipid antigen. Glycolipid antigen. Okay. So why it's called walking pneumonia? Did I wrote anything about walking pneumonia? Walking pneumonia means like the person does not need any sort of a hospitalization. Let me tell you what is the story behind this. The person initially, the symptoms are not that much that you need, mild symptoms are there. So what happens? The person does not need a bed rest. The person does not need any sort of a, immobilization. Okay. So he can do his, regular activities, daily activities. He's having those mild symptoms. That's why it's called walking pneumonia. Are we clear? That's why it's called a walking pneumonia. Okay. Now this is also understood. Now, by the way, what is the most common cause of? By the way, they can ask you a question. What is the most common cause? What is the most common cause of atypical pneumonia? It is this mycoplasma. Okay, they may ask you this, and it causes a syndrome. That syndrome is called Fitz-Hugh-Curtis syndrome. Okay. So this syndrome was also caused by what? Who was causing this syndrome? I hope you remember, it is gonococcus. Gonococcus was also doing this syndrome. I have taught you already in the gonococcus lecture. So you can watch that lecture. That's already uploaded on the YouTube. So gonococcus causes Fitz-Hugh-Curtis syndrome. I have taught you. Same is done by that parahepatitis. Okay. So what are the other manifestations? What are the other manifestations the person can have? No, after this, these are the pulmonary manifestations. What was this? Where did I kept this? This was the pulmonary manifestation. These was all the pulmonary manifestations. Okay, pulmonary manifestations. What can be the extra pulmonary manifestations? What can be the extra pulmonary manifestations? The extra pulmonary manifestations can be, it can be either neurologic manifestations, it can be, rheumatologic manifestations like arthritis. Rheumatologic, okay? Rheumatologic manifestations like arthritis, okay? Reactive arthritis, I should write rather. Reactive arthritis. Even blood, okay, even cardiac manifestations. What are the cardiac manifestations? Myocarditis. Myocarditis. What else? Skin, dermatologic manifestations. What can be the dermatologic manifestations? Dermatologic manifestations are erythema multiforme major. What? Erythema multiforme major. Erythema multiforme major. Is it clear? So, yeah, I'm talking right now about Mycoplasma pneumonia. Okay, genital manifestations will be also there. Yes. Okay. So here I am telling about this organism, pleuropneumonic. Okay. So that is about Mycobacterium genitalium. Okay, that is about Mycobacterium hominis. Okay. How will you diagnosis? Lab diagnosis. Lab diagnosis will be, you will be using, what you will be taking, since it is a pneumonia. So you will be taking BAL. What is BAL? Bronchoalveolar lavage. Bronchoalveolar lavage. What we do is we suck the contents from a bronchoscope. We suck the contents from the, we lavage the contents from the, from the respiratory tract, and then we take that sample. Okay, that is called bronchoalveolar lavage, or you can also take sputum. So I will take this specimen and then I will put on the eaten agars. What I am writing, eagle agar, no eagle agar, eaten agar. I'll put it on the eaten agar. Once you put it on the eaten agar, what will happen? You will be having some colonies. You will be having some colonies. Okay. You're having some colonies. So if you want to color these colonies, what you will be using? If you want to color these colonies, what you will be using? You'll be using a coloring agent. You have to use a coloring agent. How to color them? We color them by guys, by what? We color them by Dyne's method. Let me take another color. We dyed by Dyne's method. Don't confuse this Dyne method of staining with Dyne's phenomenon. Okay, Proteus. Dyne's phenomenon, Proteus. Dyne's method, Mycoplasma. There where this is the place where the examiner can catch you. Okay. And you can also do what? DFA. What is DFA? Direct fluorescent antibody. Direct fluorescent antibody. Okay. And we had some methods which we are not using. That is Mycoplasma cold agglutination method. Mycoplasma cold agglutination method. What is Mycoplasma cold agglutination method? Who can tell me? Cold agglutination method. Cold agglutination method means we detect the Mycoplasma antibody by using human O antigen, ORBC antigen. We take the ORBC antigen and then we detect the antibodies against it. That is cold agglutination test. But we use what antibody? Mycoplasma antibody. Mycoplasma antibody. But what is the cold? Why cold? Because it is happening at 4 degrees centigrade. I have taught you. So at 4 degrees centigrade, I am having agglutination. Clear? Okay. Okay, fine. We have understood this also. So what will be the treatment? Treatment will be, so the treatment will be guys, will be the treatment. Treatment is azithromycin, or you can use any fluoroquinolones. Fluoroquinolones what? Moxifloxacin or levofloxacin. Okay, this is, I think, most important things, from which previous years questions have been asked also. And I think, at least if you remember this much, that's, sufficient, more than enough. So, I want to tell you a case. Okay, if you want me, I can tell you the case in the end. So what they will be asking, the scenario is, a person is particularly coming to you, his age is, around 20s, less than 30 years. Okay. So patient comes to you and there is any sort of, a military recruitment is happening, or colleges or prisons. So in those persons, this will happen frequently. Okay, so they will be giving you a case that we were doing a military recruitment. Military recruitment is happening, and suddenly patient is coming to us. He was first having a mild insidious onset of headache, of pneumonia, and once we took the chest X-ray of that patient, we are able to appreciate the chest X-ray is showing the features more than the presentation of the patient. And once we took the IgM titer also, we agglutinated it. We had a cold agglutination test positive. Like that, they will be asking you. So you will say that most probably the causative agent of pneumonia is, because pneumonia can be caused by many organisms. So who is causative? We are also having PCP pneumonia. What is PCP pneumonia? Pneumocystis jirovecii pneumonia. Pneumocystis jirovecii pneumonia caused in the AIDS patient. CD4 count less than 200 or 400. So Mycoplasma pneumoniae will be the causative agent for this, because you are having all the features of that. Okay, or sometimes they will tell you we have a child and he is having an atypical Steven Johnson syndrome. Okay. Or we are having, an adolescent who is having a Steven Johnson syndrome, an atypical variant of Steven Johnson syndrome, most likely to be caused by Mycoplasma pneumoniae. Mycoplasma pneumoniae. Okay. Are we clear with this? I hope you have enjoyed this session. So please read the book. Okay. And see you in the next topic. Take care. Bye-bye.